Hi. I'm Eliza. I'm one of the newest stuffed animals that just came here. Today, I'm going to be playing my very first game. This is something about an ingrown toenail removal. I don't know about ingrown toenail removals, but one thing I've learned about the causes is that one of the causes is poorly fitted shoes. Like shoes that are too tight or too loose. I've learned that because a previous friend of mine from a zoo had an ingrown toenail. Well, without further ado, let's get started with the game. Pretty good loading screen.
Hello, and welcome to Surgery Squad's virtual ingrown toenail removal. I'm Dr. Jeff,
Hello,
and
Jeff.
I'll be guiding you through this procedure today. An ingrown toenail happens when the edge of the toenail grows down and into the flesh of the toe. When this occurs, there is usually a moderate amount of pain, redness, and swelling around the toenail. An ingrown toenail is usually caused when extra pressure is applied to the toe due to shoes that are too tight or too loose. Improperly trimmed toenails, foot or toe deformities, injuries, and fungal issues can also be contributing factors.
Right there.
There are some ways to treat an ingrown toenail at home to relieve some of the pain.
Why do they have to show us
But
like an
remember that
actual
you should
toe?
never attempt to remove an ingrown toenail
A
yourself.
cartoon toe would have been
If
better.
you're diabetic and have an ingrown toenail, it is recommended that you go to the doctor immediately. Now that you understand the causes of an ingrown toenail, let's put on our gloves and remove one.
Okay, my gloves are on.
Our patient is ready,
See,
so let's
that's what I
begin
like
by
it. That's what I
disinfecting
wanted
the
to see.
toe.
Okay, I'm gonna disinfect. Huh? What's that say? Dr. Jeff's iodine? Interesting. I think it's best if I paint his whole foot. Well, at least like this part of his foot, not his entire foot. I wonder if doctors are allowed to paint a patient's whole entire part of the body that they're doing incisions on.
Now, we need to numb the toe with a local anesthetic. We'll have to inject
Didn't
the
we already
anesthetic
just
in
numb
several
it?
locations around the toe.
Or just paint it or something? Oh gosh, not a needle, no. I hate needles. Seriously, right at the tip of the toe. Okay, well, he probably won't feel that one because that one's all infected.
Great. Now we'll wait a few minutes for the toe to get numb.
Okay, try not to puke. Huh? Oh, 5 minutes later. You know, I think Taffy should do some transitions. Once you learn
Now
how
that
to,
our
that
patient's
is.
toe is numb, place the special tourniquet around the toe. This will help reduce the amount of blood coming from the wound. Once
Okay, we get it. Be quiet.
First, carefully slide one blade of the nail anvil under the affected nail.
Okay, let's get this over with.
We're going to go down the nail until we feel a little bit of resistance. Our patient's going to feel some pressure as we cut away the ingrown nail.
I think he's gonna feel a lot of pressure. Ugh. How can a patient even feel pressure when they're put to sleep? Seriously, they had to like, shove it right inside to the toe? Ugh.
Great. Take the forceps and carefully remove the ingrown nail.
Oh, God. Oh, that's gross.
It's getting kind of messy in there. Let's clean up that
Obviously.
blood.
Thanks for the news flash, Captain Obvious.
See that small bit of pale yellow substance right there?
Yeah, what
It
about
looks
it?
like the patient has a bit of infection in the toe. Firmly squeeze the edge of the toe to get as much of that infection out as you can.
Oh, God. All right, guys, get ready for this. Get ready for this. This is going to be really gross. Oh, my... Told ya!
That toe is starting to look much better, but we're not done yet. Next, we're going to apply some phenyl acid to the wound. This will help ensure that the problem of ingrowth will not reoccur in this toe. When you're done inserting the acid, I'll remove the
You're just
tourniquet
putting a
and we'll
stick
finish up.
inside. What is that stick for?
Finish by applying some antibiotic ointment on a sterile gauze pad.
Okay.
Place it against the toe and wrap it in a gauze bandage.
I'm not even doing anything. The game's doing it all for me. But there's one question that's
Fantastic
gonna ask.
job. Since there was some obvious
Will that
infection,
toe grow back?
our patient will be sent home with a prescription for some antibiotics. We'll also need to tell our patient to keep the wound dry, clean the wound regularly, and replace the bandage 2 to 3 times a day.
This is gonna be not
While our
complicated.
patient's toenail isn't likely to regrow, his condition is likely to return if he doesn't take care of his feet. This includes wearing proper fitting shoes, properly trimming his toenails, and keeping his feet clean and dry. And that's how we remove an ingrown toenail. You did a great job today. While you're here, try your hand at one of our other surgeries here at surgerysquad.com.
Wow. A toe doesn't regrow once you remove it. Well, that's a shame. Plus, that's all I have for today. Don't forget to like, subscribe, and turn on post notifications.